Remington West, and I'm a 2 weeks practicum student in the Department of Health and Safety and Security of Saskatoon Polytechnic in Saskatoon campus. I'm here to make a presentation, 8 to 10 minutes presentation on my practicum, and I have a topic, medical emergency, and I chose heart attack. So learning objective, at the end of this discussion, we should be able to take home, identify the meaning, causes, and the risk factor of a heart attack, recognize the signs and symptoms of a heart attack, demonstrate appropriate emergency response for a heart attack. What is a heart attack? Heart attack could also be called myocardial infarction. This occurs when blood flow to the heart is blocked, usually by a clot. It can lead to severe heart damage or death if not treated quickly. Causes of heart attack: blockage in the coronary arteries due to arteriosclerosis, that is a building up of plaque. It's a condition where the fatty acid, which is the plaque, made up of cholesterol, fat, calcium, and other substances build up inside the arteries. This happens over time, and when this happens, it narrows and hardens the arteries, reducing blood flow, which increases the risk of a heart attack. Other causes are blood clot formation. When a blood vessel is damaged or a plaque ruptures, the body forms a clot, which could also be called thrombus, to stop bleeding. However, in arteries, these clots can block the blood flow, leading to a condition such as heart attack if they completely obstruct the blood vessel. Another cause could be spasm of coronary arteries. A coronary artery spasm is a sudden tightening of the spasm of the blood vessel that supplies blood to the heart. This temporarily reduces or blocks blood flow, potentially causing chest pain or even a heart attack. See, unlike the arteriosclerosis, spasms occur due to temporary narrowing rather than a permanent blockage. Other risk factors that could cause heart attack is high cholesterol, high blood pressure, smoking, obesity, diabetes, stress, or family history. So one way we can reduce stress in a workplace like this, Jill has that app, the Argo Suits. It pops up on your computer every 30 minutes or 1 hour, depending on the setting. It reminds you to stand up and stretch your body or move, do some activity for some time. So that's a very good app. When I saw it, I was like, this is good, because sometimes we can get too busy with work and we forget that we have been sitting for like 3 hours on a row. So signs and symptoms of heart attack. Classic symptoms: chest pain or pressure, often described as squeezing or tightness. Pain spread to the arm, jaw, neck, or back, and then shortness of breath. Other causes could be nausea or vomiting, cold sweats, dizziness, or lightheadedness. What to do in case of a heart attack? The immediate steps. The first thing you do is call 911 or any emergency services immediately. Keep the person calm or in a seated position. Losing any tight clothing, that is, if there is any. If the person is conscious, give aspirin, chewable, between 160 to 325 milligrams, unless the person is allergic. So you can find out from the person if you can give. As if the person is conscious, the person will be able to tell. If the person is down, you can say, can I give you aspirin? Blink your eye once if it's yes, you can blink twice if it's no. So the person's response will tell you if it's something he can take at that situation. That is if the person is conscious and is able to respond. If the person becomes unconscious, we begin CPR, cardiopulmonary resuscitation, or AED. Prevention of heart attack. Lifestyle change. They say eat a heart healthy food, low in saturated fats and high in fiber, like fruits and veggies. The other day I saw Dana taking veggies. Very good. Exercise regularly, at least 150 minutes per week. Maintain a healthy weight. Manage stress. Medical prevention, regular health checkup. Manage blood pressure, diabetes, and cholesterol. Medication. If you're on a medication, you keep to it as prescribed by the doctor. And then we come to summary and conclusion. We say heart attack are life-threatening but can be preventable. Recognizing symptoms early can also save lives. A quick action, call 911, begin CPR or AED, automated external defibrillators. That is if you're trained to do that. These are very crucial steps to take in a situation like that. Questions and answers, discussion.